Hello friends, I'm Dr. Amit Goel, consultant urology, uro-oncology and kidney transplant surgeon. Friends, I'll be talking about bladder cancers today. Bladder, where is it located first of all? So urinary bladder is located at the lower part of the human body. So these are the two kidneys and this is the pipe which drain the urine, and this goes and gets collected in the bladder, and from here it is passed out of the body. Friends, bladder cancer is more common in males as compared to the females, and the symptoms that the patients have is bleeding in urine or clot in the urine, or sometimes the patients might complain of burning in urine. It is usually diagnosed by the ultrasonography or the CT scan, and more than 95% of the tumors that happen in the bladder are cancerous. Causes of bladder cancer include tobacco chewing or smoking, and also exposure to chemicals and dyes. Now, the treatment of bladder cancer, it depends on the stage and the grade of the tumor. Initial treatment in all of the bladder tumors is TURBT, that means transurethral resection of bladder tumor, which is a no-cut surgery. We go in through the urethra with a telescope and cut out all the tumor till the base, and we send that for the histopathology or biopsy, and then the further plan of management is decided depending upon the biopsy report. If it is a low-grade tumor, then the TURBT that has been done is sufficient. We just have to give the patient intravesical chemotherapy in the form of mitomycin C injections, and we keep the patients on follow-up. In the case of high-grade tumors, these can be further subdivided into two types. One is a non-invasive high-grade tumor, and the other is muscle-invasive high-grade tumor. So the non-muscle invasive high-grade tumors are just restricted to the mucosa, that means the innermost lining of the bladder. They have not involved the muscle layer of the bladder, and in these patients intravesical BCG or immunotherapy suffices, that's all, and we just have to keep the patient on follow-up. For any patient in whom the tumor has gone inside the muscle, that means it has invaded the muscle, we call it as muscle invasive bladder tumor. These are the patients, if the disease has not gone out of the bladder anywhere, if it is only restricted to the bladder, we have to offer these patients radical cystectomy. That means we have to remove the entire bladder, and once that bladder is removed, because bladder acts as a conduit for the urine, it accumulates urine and then we pass it out, so we need to make an alternative channel for the urine. So that might be in the form of either ileal conduit, in which is made out of the intestine, and there's an opening that is made on the tummy, or it might be in the form of a new bladder, in which we make a new bladder from the intestine and we connect it to the native urethra, and the patient passes urine from the normal urethra. Thank you.